Hello, Mrs. Rupel. How are you doing today?
I've seen better days.
Oh, I'm sorry to hear that, but so I'm Miss Watson, and I'm going to be your clinician today. We're just going to talk about your voice results from the assessment we did last week. So firstly, I wanted to point out that with the help of an ear, nose, and throat doctor, we figured out that you have a granuloma on your left vocal fold, which is a result of the rotator cuff surgery that you had 6 months ago. And so this means that when the tube went down your throat to help you breathe during surgery, it created an irritation on your vocal fold.
Okay.
And so then the granuloma is a buildup of that scar tissue.
So granuloma is not cancer?
No, not cancerous.
So I was like, how did I get throat cancer from shoulder surgery?
Right.
Yeah, I can't talk.
Yes, no problem. It's just from when the tube went down your throat, it caused some irritation on your vocal folds.
Okay.
So then it caused that scar tissue to build up.
Okay.
And so that's how the granuloma formed. And then I have an example for you here of what a granuloma looks like. So here on the left, you'll see that this is what normal vocal folds look like. They don't have any kind of marks or anything like that on it. And then on the right is an example of a granuloma. And so it's just a little buildup of scar tissue. And so when your vocal folds are coming together, when you're talking, they go in a wave motion. And so since the granuloma is there, it's preventing your vocal folds from coming together, which is part of the reason that we have pinpointed that you have the pitch breaks that you're experiencing, and then also the rough voice quality that you've noticed.
Okay.
So do you feel like you've had a difficult time maintaining your voice during speech?
Yes.
Yeah, so that would be the pitch breaks that I referred to, which was also confirmed by our test last week. And then also the roughness is kind of described as a raspy or hoarse voice quality from our patients. So do you feel like you kind of have that going on too when you're talking?
Yes.
Yeah. So that makes sense based on what we found too. And then lastly, because of the granuloma's position, like I was telling you, it creates the problem while you're speaking when your vocal folds are coming together. But this is treatable, and we have a couple of options for that. Do you think you'd be interested in doing some voice therapy?
Sure.
With us?
Anything that'll help.
Awesome. Well, I'm happy to hear that and happy to work with you through the process. So we're going to look at some treatment options. Okay, so there's a couple of different options with the granulomas. So we can start by doing a non-surgical method, and we'll do an inhaled steroid through your mouth, and that reduces inflammation of the granuloma. And then with that, we'll also do voice therapy, and then in conjunction with each other. And if you feel like that's kind of helping, then we can continue with that, or we can go straight to surgery with voice therapy and see if that helps more. So I know this is a lot to be thrown at you at once, but do you kind of have one way that you're leaning towards?
Let's just do the surgery and get it over with.
Okay, all right, that sounds great. I have a lot of patients who choose to do surgery first. So what I'll do is I'll schedule you a referral with a surgeon, and he'll talk more about the surgery with you. But as far as the voice therapy goes, we're going to start with increasing your vocal hygiene. So that just has to do with keeping your vocal folds healthy and hydrated. So right now, how much water would you say that you drink on average?
I probably don't drink enough, maybe 2 glasses a day.
Okay, and what about caffeinated beverages like coffee, tea, soda?
Maybe 1 cup of coffee a day, maybe a cup of tea in the evenings.
Okay, so that's actually pretty balanced, but let's try and get your water intake up. So what we'll do is we'll have you keep a journal about your water intake and then your caffeinated beverage intake, and we kind of want those to balance out, if not have your water be more. I know sometimes it's hard to drink a lot in one day.
Okay.
So yeah, so we're going to start with that, and then the other thing, I know you had a lot of throat clearing going on. So how often do you think that you do that a day?
I don't know, probably 10 to 20 at least.
Okay.
I haven't really paid much attention.
Okay. That's another like subconscious thing that just kind of, you know, we automatically have and clear our throat. So we're also gonna keep track of that, and in your journal, if you could just tally how many times you throat clear a day, and try and be a little more mindful of when you're clearing your throat, and try to reduce that because it puts a lot of tension on your vocal folds. And with your granuloma, then after surgery, you know, everything's gonna be a little bit weaker and need to get strong again. So if we can reduce that vocal abuse.
Okay.
And then I also have a handout here for you that tells you ways about how to increase your vocal hygiene.
Okay.
So there's just some tips on there about what you can do, and then there's also negatives on there that tell you things that aren't good for your vocal folds. So that I think that'll be helpful while we're going through this. So you have any questions for me?
No, not at this time.
Okay, awesome. So I'll have you go ahead and keep track of your caffeinated beverage intake, your water intake, and your throat clearing. And then if you just keep like a week log, and then we'll compare and see where things need to be cut down.
Okay.
Does that sound doable to you?
Yep.
Awesome. All right. So now we're gonna assume we're post-surgery, and you're coming back in. So it's great to see you again. How are you feeling today?
Much better, thank you.
Good. I'm glad that you're having pretty quick recovery and not too many side effects from the surgery.
I can't, not at all.
Awesome. I'm glad to hear that. So today we're going to look at your journal that you've been working on and see how your water intake has been, and your caffeinated beverage intake, and your throat clearing.
Okay.
So how do you...
My logs.
Thank you. So how do you feel like you've been doing with getting the water intake?
Oh, much better. I didn't
Good.
realize how much better I'd feel after drinking more water.
Awesome. I'm glad to hear that. You've had good effects from that. And so now that it seems like we had this on track, what about your throat clearing? Do you feel like that's increased or decreased at all?
I feel like it's decreased a lot.
Okay, great. And I think that has to do with removing the granuloma and removing that irritation on your vocal folds. But I'm glad to see that that's reduced on your end too. And so now that we have that covered, we're gonna move into a new therapy technique, and it's called easy onset. And so I chose this one for you because it reduces the tension on your vocal folds. And like I told you before, your vocal folds are a little bit weaker after the surgery and having that granuloma removed. So we're gonna build up that strength and try not to overuse them.
Okay.
So the way that you're gonna do this is by turning your voice on what we call easy. So you'll use extra air when you say each word, and it almost comes out sounding like an H sound. So instead of saying ice, you'll say ice. You hear the difference?
Yes.
Okay, great. So I also have the speech slide that we can use. Have you been on a slide before?
Oh yeah, it's been a while.
Yep, so this line over here, it represents you breathing in, and then down to the midpoint, that's where you'll make your H sound, and then you'll move into the next word.
Okay.
At the later part. So I'm gonna demonstrate for you using this word. So we're gonna make it into hot.
Mhm.
Okay. So hot.
Okay.
All right. Let's see you try.
Hot.
Yeah, that was awesome. I really like how you controlled your breath coming out and used your easy voice. All right. So let's try this next one.
Hand.
Perfect. Yep. That's awesome. If you could try that one more time and have your exhale last a little bit longer on the H.
Hand.
Yep, perfect. That's awesome. All right. And then go ahead and try this one.
Each.
All right. So try a little bit slower on that exhale again.
Each.
Much better. Yep, that's perfect. That was great airflow and great breath support. All right, and then we'll try this last one.
Apple.
Very good. Try one more time, including the H before.
Apple.
Yep, perfect. That was awesome. So do you kind of feel the difference in using your easy voice versus your normal voice?
Yeah.
Okay. So using this every once in a while will help reduce the stress on your vocal folds, and as you start to heal, we'll reduce this a little bit, so you won't have to rely on it as much. It'll become more of a habit.
I don't have to carry this around with me?
No, not at all.
I'll try to remember.
Awesome. Well, that's it for today. Do you have any questions for me?
No.
Okay.
You've been pretty thorough and helpful.
Awesome.
I appreciate it.
Well, I'm glad to hear that. I will see you next week, and we'll work on this some more and then look at your journal again.
Okay, sounds good.
All right. Thank you.
Thank you.